hello to all my viewers once again from Faces of South Asia. Welcome. We have a wonderful show today. We have Jamie Osborne from South Shore Mental Health visiting us at the show.
Hi.
Welcome.
Thank you. So I'm Jamie Osborne. I work for South Shore Mental Health. We are one of the largest, if not the largest, community mental health centers in Massachusetts, covering from just north of Boston in the Everett area down through Hyannis on Cape Cod. We have about 700 therapists, clinicians working with us in a variety of settings, including outpatient, in-home, intensive treatment for families in crisis, early intervention, day treatment programs, a real broad spectrum of community mental health services. We also have a very substantial number of clinicians who are part of the Asian Coalition, who work here in Quincy and work with our agency. Korean, Taiwanese, Malaysian, Chinese, Vietnamese, Indian. I'm trying to think of all of the nationalities I'm aware of just in my office.
Excellent.
So we do have a lot of services for the community. And I am at South Shore Mental Health since 2006. And you asked me to speak about postpartum depression.
Absolutely.
In 1978, I had my first child by cesarean section. And it really threw me for a loop. It was not the delivery I expected. It was very much a wanted pregnancy and a wanted child. And it was a very disorienting experience for me. And that was my introduction to postpartum depression. Several years later, I got involved with counseling other women who'd gone through similar experiences. So not even several years, within a year. So I've been counseling women around postpartum depression since 1979. With the birth of my second child in 1981, I became involved with learning about midwifery. I had my first by cesarean, my second and my third were natural deliveries. And in spite of that, still had a little bit of depression. Had desired outcomes and was still off balance.
Did a lot of people talk about that?
No. Women's health is really, in many cultures, not all, but in many cultures, is a big secret. Our bodies, what happens with our bodies is inside, and we're taught not to talk about our feelings about our sexuality or about our expectations for pregnancy and delivery, or the disappointments. We're supposed to be happy when you have a baby.
True.
What do you mean you're sad? What's the difference between normal baby blues and postpartum depression? And
Very
that's
important.
a big question.
Yes.
So I'm going to come back to that in a second because I want your viewers to understand where I'm coming from. It wasn't just my own experience. So in 81, I learned to be a midwife. I was a direct entry midwife. I did not have a medical or a nursing degree, but I had extensive training in what a normal, healthy delivery, pregnancy, delivery, and postpartum should be, and had a network of support with doctors and other midwives. I helped to found the Massachusetts Midwives Alliance and to help write risk factor protocols and guidelines for safe birthing at home. But I wasn't locked into home birth. I wanted women to have a positive birthing experience. I became a childbirth educator because I wanted women to be more prepared to have these positive birthing experiences. I went on to, I've been a teacher. That was my training. So here I'm teaching women and families from conception through the childbearing years. Worked as a teacher for many years, and then that evolved into doing some counseling. My personal life, I had been in the theater. I'd been an actress. I'd done other things in the theater, creative arts, and I combined that training, the expressive arts training and the drama therapy training. I went back to school and became a mental health counselor so that I could take all of these threads of my life and bring them to the table.
Excellent.
And I would say that probably about a third of my clients now are women's health, perinatal, peri meaning surrounding, so they either come to me early in a pregnancy or partway through a pregnancy or are referred postpartum, or now perimenopausal, women who are going through the changes of their life and their bodies on the other end of the spectrum. Let's focus on the perinatal, the issues around what causes postpartum depression. We don't really know. The honest answer is there are lots of things that are happening in a woman's body that can cause postpartum depression or not. Changes in the hormones. Anytime you have a hormonal change, whether it's from diabetes or a thyroid condition or pregnancy, it affects your mood. Changes in work and social relationships. You've had a circle of friends. None of them have children. You're now pregnant. You now have a child. You no longer have the ability to just be spontaneous and go out to a movie. You've got to figure out what to do with this kid. You now have less free time and more responsibilities. Sleep deprivation. The end of pregnancy sets you up. It prepares you for that, sort of, with the disrupted sleep. As the baby gets bigger and you have to get up and empty your bladder more frequently. But it's still just you. After the baby is born, it's not just you. It's this other little person that you have to take care of at that point. And then that leads to, am I being a good enough mom?
True.
And that can stem from both the fact that you have had a wonderful role model, and are you going to live up to those standards? Or you've had an awful role model and you don't want to repeat those mistakes. Either way. So some women actually start to feel like maybe the baby would be better off without them. I can't be a good mom. I don't know how to do this. Maybe my baby would be better off without me. And then they feel ashamed. What's wrong with me? I should be happy I have this baby. I love the baby. I don't know what to do with the baby. But I want to hide this because I'm supposed to feel happy. And what I can say is if you've got any of those feelings, don't hide it. Talk to your friends, talk to your family, talk to a clergy member, talk to another trusted individual and say, you know, something's just not quite right, I need help. So those are some of the basic risk factors. Some other things to think about, and I do have notes because there's so much here that I want you to be aware of.
Absolutely.
If you've had depression after one pregnancy, you are more likely to have it after subsequent pregnancies. And that's something women don't think about. They think, well, you know, I've been through this once. This should be fine. And it doesn't turn out that way. And then all of those feelings of inadequacy are even bigger. And the depression gets even worse.
How long does it last?
It can last anywhere. It usually is evident within the first 3 months. Untreated, about 50% of the women who experience it can resolve itself within 6 months to a year if it's mild. However, the statistics for mild postpartum depression is anywhere from 10 to 15% of all women who have babies. And of those, 8%, 8 out of 100 women will have moderate to severe postpartum depression. And 7%, 7 out of every 100,
Wow.
could have depression that's so severe they have what are called psychotic features. They begin to lose touch with reality. They hear voices, they see things, they don't connect well with the baby at all. The implications for the baby are pretty dramatic. And we can talk about that later, but really want to focus on the mom.
Absolutely.
Other risk factors. If you or anyone in your family has a history of depression, bipolar disorder, or postpartum depression, any other major mental health condition that exists in the family line, the hormonal changes are so dramatic that they can make those conditions worse. If you don't have enough support, if you're working and trying to take care of a baby and you're in a family system that requires you to take care of aging parents or care for another family member that maybe has some sort of a disability, that's going to add to it. The more isolated the woman is, the greater her chances for being depressed. If there's instability in the relationship, you're not married, or you're married and it's not a good marriage.
Yeah.
Not even talking about the domestic violence component that can absolutely make this worse. And if you're not really sure you wanted to have this baby in the first place, it was a planned pregnancy, or it wasn't planned, but I don't believe in abortion, so here we go. All of those can add to the concerns. I just want to be sure. Okay, so those are the big, environmental and genetic risk factors. As we look at some of the statistics, these statistics are across ethnic, cultural, racial, age, economic spectrum everywhere. 1 in 10 new moms, whether it's a first baby or a 5th baby, will experience anxiety. You've just brought a new human being onto the planet. That's anxiety producing. So that, I would say, think about that. That's 10%. That's normal. 13 to 15% have the depression set in within the first 3 months. Usually it's within the first year. And it can still be considered an adjustment period, even if it doesn't kick in till a year later. Now, Quincy has a very large Asian community. We're talking about Faces of Asia and South Asia here. The challenge with the Asian community is that it's difficult to determine statistically what the ratio is. In part because, as difficult as it is for any woman to be comfortable talking about women's health issues, for the Asian community it's even more
Taboo.
Taboo would be a really good word. It's forbidden. You don't admit to feeling uncomfortable or sad or depressed or inadequate because it reflects on your family.
Yes.
It's not just me as a mom. If I can't handle this, what does this say about my extended family? What does this say about my mother and her mother before her? That I'm not a good mom. And so there's a silence. And even if they acknowledge that there's a problem, there's the cultural
Restrictions.
roadblocks for seeking help. What do you do with it? So what has been in the research that I've done through the National Institutes for Health and the World Health Organization, the information that I've found is that really throughout South Asia, we talk about the Philippines, India, Laos, Cambodia, Vietnam, Japan, China, the whole region, Korea, even parts of Korea, is that instead of talking about feeling depressed or anxious or worried about their baby, women will talk about having stomach aches or headaches or backaches or being overly tired. And in one study that I found, Chinese women have the highest death by suicide rate across all racial and ethnic groups. Women of childbearing years.
Never knew that.
And so how do Chinese women deal with this feeling of inadequacy and the fear and the shame that goes along with it? They leave their children because they commit suicide.
Unbelievable.
And it's successful suicides. So it's not just suicide attempts, it's the highest rate of successful suicides. It's 20 per 100,000. It's still a small percentage, but across all ethnic and economic groups, they have the highest rate. So it's something that, as therapists in the community, we need to be more aware of.
Oh, definitely.
So,
Is it like a chemical imbalance, or what would you say?
we don't really know. It's the changes in the hormones are so dramatic, and as I said, if you've got diabetes, your insulin levels are changing. It can cause depression and anxiety. If you've got a thyroid condition, your thyroid levels are changing. When you're pregnant, your estrogen, progesterone, testosterone levels are changing. And when you don't know what to expect and you don't have the support around it and you're not allowed to talk about it, it can make the symptoms worse. So, symptoms.
Yes.
What happens? Many women feel a little overwhelmed. Many women feel a little sad. Many women feel teary-eyed. And when you talk to them about it, they'll say, it's tears of joy. You know, oh, it's the hormones, they haven't settled down. It's much like feeling premenstrual.
Yes.
Okay. When those feelings become feelings of agitation, when they go along with changes in appetite, when you start to feel worthless or guilty, when you feel withdrawn or disconnected even more than you were before, when you lose interest in things that used to be fun, or don't feel like doing anything but sleeping, when you can't concentrate, when you have no energy, you can't take care of the house, your anxiety goes up and it becomes uncontrollable. When you start thinking about death, become obsessed with death, the baby's going to die, I'm going to die, I'm going to kill the baby. When you have trouble sleeping, can't make decisions. Those kinds of things are typical symptoms of postpartum depression. It goes beyond the new baby blues and it lasts longer. Okay? Most of the time, it starts within 3 months, but the baby blues kind of shift once the baby isn't sleeping all the time. And once the baby starts interacting at 3 to 5 months, those baby blues lift. With postpartum depression, it doesn't go away.
It doesn't.
It doesn't go away that quickly. So when do you call for help?
Yes.
Yeah, and that's really important.
Very.
Get help right away if you have any thoughts of harming yourself or your baby. Right away. Don't wait. Tell a friend, tell a doctor, tell somebody you know immediately, because you can get help. That's the biggest one. If you're not able to take care of yourself or your baby, if you don't shower for days, these are signs that family members should look for. Is the new mother taking care of herself? Is she bathing? Is she eating? Is she holding her baby? Is she changing the baby's diaper? Is she feeding the baby? Or is she ignoring the baby? If you feel like you're afraid to be alone with the baby, even if you don't think you would hurt the baby, if you feel like you're afraid to be alone, that's a sign you need help right away. If you have negative feelings toward your baby, this baby is a demon, it's possessed, it's evil, I can't look at it. I've heard of clients, in my experience, in our experience in the agency, we've had women who've talked about that they have these thoughts, they don't act on them, but they're scary. They're very scary thoughts. They're almost never acted upon. But just having those thoughts means that your body chemistry is out of balance and you need some help. And if you over worry or have no worries, two extremes. The baby's crying, it's not a problem. The baby wiggled, oh, what's wrong? Both of those are indicators that you're not looking at things from a realistic here and now perspective. And remember, this is the chemistry in our bodies is out of balance, and when that's out of balance, it affects our minds. It's all one. So, step one, ask for help.
Absolutely.
Ask for help. Talk about your symptoms. Don't be afraid to talk to your OB, your pediatrician, your primary care doctor, a best friend. Talk about it, talk about it, talk about it. The most effective treatment for postpartum depression is support groups. Whether it's peer support or professional support. Talking about the feelings, getting them out of your head so that you can deal with them is the most effective treatment across the board. Other things that the doctors, the primary care and the OB could start doing if you've had postpartum depression in the past is they could get you into treatment partway through your subsequent pregnancy, get you on medication at that point. Antidepressants can be used if you're not nursing your baby, and they can be used. There are some that can be used safely during pregnancy. You want to consult with somebody who knows about what are called psychopharmacological or psychiatric medication, antidepressants, anti-anxiety medications. That's not my area of expertise. I focus more on how can I help you change how you're thinking, how you're feeling, what you're doing. And that's the way most of the therapists working with us work. So sometimes they have found that home visits immediately postpartum, women are sent home from the hospital so quickly now, and if you don't have supports in place, you're kind of left out there not knowing what to do. So postpartum home visits can really be helpful, and I encourage you to ask for them. I think more and more OBGYN practices are looking into that, or they're having you come back into the office sooner. Culturally, especially in the Chinese culture, you're supposed to not do anything for at least a month after your baby's born. I know that. It used to be a very common practice. It was called lying in the Western world, where there were hospitals where women went and they stayed for a month after their babies were born. And they pretty much hung out in bed and just nursed their babies and got pampered a little bit. Well, our world doesn't support that very much anymore. Get out there and go back to work. Doesn't matter that you just had a baby. So even if a Chinese family's baby required extensive medical care, often it's found that the moms stay home and send other people, or they'll come in a wheelchair because they're still lying in. They're still in that month of postpartum rest.
Sure.
On the one hand, it gives your body a chance to find its balance again. It makes sense.
It's probably just the Eastern culture, because it's not just the Chinese who do that. From India, people do that too. I remember, there used to be a midwife who used to come and just do massages for the mother and the baby. That's all they did. But I don't know. Now it's not done.
What
so
it is
much.
Yes, all over the East we have this culture, but you have to live. That's why it's very important. You're coming to the West, you're coming to work, you're immigrating.
Right.
So you need to now get into the groove. You need to follow what we have here and forget about the back home.
Or have the supports that you had back home here.
This
and
is
if
right.
the supports aren't here,
Yes.
and you have that expectation, Remember,
consult.
I spoke about my expectation of having a natural delivery with my first baby.
Yes.
I'm my body is perfectly capable of carrying and delivering a child. And then it wasn't. So I had this expectation that got taken away. And if you have an expectation because culturally your mother told you stories about when she had you,
Yes.
and how she was pampered, and how she learned how to do baby massage while she was getting massages, and your grandmother told you about when she had your mother, and now you're here and they're not here, and there's no midwife here, and there's no postpartum massage here. What are you going to do? That expectation is shattered, and it can lead to more depression.
Absolutely. Well spoken. Very well spoken.
As a midwife, did you actually go to people's homes?
I did.
You did?
I
Okay.
did.
And deliver babies at
I
the house?
did.
Oh,
I
okay.
did.
That was the culture some time back, just like she meant.
Well, in the 80s, there was a resurgence, in part because the cesarean section rate had gotten so ridiculously high. And there was a group of women who got together in this area and said, if 35% of all babies need to be delivered surgically, we are a dying race.
Yes.
And let's educate women about their bodies. Let's educate women about what normal childbirth is and what isn't. So that, again, risk factors. Somebody, women were monitored very carefully in their prenatal period. We had our clients always had consultation with an OB/GYN to be sure there was backup, that if something happened, there was an MD
Yes.
on call and an ambulance moments away and a hospital that we had connected with. So it was not stay home no matter what, like many people thought. It was, let's create as positive a birthing environment as we can, an empowered birthing environment. And there were actually freestanding birthing centers. I worked at one in Malden for a while with a wonderful doctor up there who was affiliated with Malden Hospital, but he had his office downstairs and he had an apartment upstairs that was set up where families didn't want to go to the hospital, but they weren't sure they wanted to stay home. So it was sort of an in-between place. There was a birthing center in Beverly. Newton Wellesley Hospital and Mount Auburn Hospital created more family-centered
Yes.
labor and delivery units, and that grew out of that movement in the 80s. So women had prenatal care. They were seen monthly, and then every 2 weeks, and then weekly, just like at a doctor's office.
It was more personal. It was,
A
I would say,
lot more
one and
time.
done. Yes.
And two other pieces to think about. Women's bodies tune into each other.
True.
You have a house full of women, you're all going to be on the same menstrual cycle.
You're right.
It's because our hormones talk to each other. Okay? So they have actually done studies where they've taken the blood of midwives and doctors, male doctors. And what they found is, being with a woman in labor, the women who were part of the support team had higher levels of the labor and delivery hormones in their bloodstream, even though they weren't pregnant and had never been pregnant.
Excellent.
And the men didn't. So
Sure.
women in labor and delivery tune into each other, get into a rhythm. A lot can happen with that kind of support that's unspoken. And again, women's health, it's not talked about. That doesn't mean that every OB/GYN should be a woman. What it means is that men have to work a little harder to tune in.
True.
And it also means that as much of a loving, supportive partner as you may have in this baby's father, he's going to have to work harder to tune into. So, home birth versus hospital birth. There were disappointments at home too. There were women who wanted home births, really wanted home births. With my second child, I wanted a home birth. But because I went beyond what my estimated due date was, my birthing team didn't feel it was safe for me or my baby. I wanted a positive birth after my first experience. And I said, okay, if everybody is going to chew their fingernails up to the elbows, I'll go to the hospital. We're going to be fine. We went to the hospital, we had the baby, and 3 hours later we were home.
Oh my God.
3
Because
hours later?
there was a pediatrician there who could check her out. I was fine. We went home. I had my home birth support team in place, so those supports after the birth were there. I had people there lined up to help take care of my son. There were people there who could help take care of us, like you talked about with your culture. So if you set it up, it's important. Now that's my personal experience. As I work with my clients who come in, they're not looking for home births. They're talking about, I had a baby and all I can think of is that something's going to happen to her. Mm-hmm. Or I brought a son into this world and I live in a community where all the boys grow up and get hurt.
Mm-hmm.
Oh.
True.
Fears that are based on what's going on in the world around you,
Right.
but they've taken over. I'm so afraid I can't sleep. I wake up and check on the baby every 20 minutes because I want to be sure nobody's taken it. These are the kinds of things that are those warning signs that you need a little extra help. So when women come into therapy, what kinds of treatment can they expect? First of all, you get to talk about it.
Mm-hmm. Very important.
Very important to normalize. You're having a normal reaction to something abnormal. Whether it's abnormal in your body because of your body chemistry, or abnormal in the community because of what's going on around you, or in the world we live in right now. It's a scary place. So, talking about it. Learning how to calm yourself so that you can calm your baby. A lot of women end up with they have a fussy baby. Babies kind of feed off the mom's energy.
Yes.
And if the mom is overwhelmed and tired and frustrated and agitated, well, guess what? The baby escalates too, and that just fuels the mom. So
Never
learn
thought of it. Never thought of this. Thank you.
Yeah, it's very true. And often all it takes is somebody coming in and saying, "Can I take the baby for a minute?"
Yes.
And all of a sudden, it's like, how'd you get the kid to calm down? What'd you do that I did? How'd you do that? And all it is a different energy. A change. You both needed a timeout.
Yes.
Okay. So teaching women how to do that, how to ask for that kind of help, how to say to my mother or my mother-in-law or my sister-in-law, my older child, will you watch the baby for 2 minutes and go to the bathroom by yourself? Have a glass of water, have a cup of tea.
So true.
You know, not leave the baby unattended, but take a personal time out when it's safe. Ask for help. When you can't get that help, therapy can teach you how to self-regulate, how to turn the volume down. That's really how I think of it. How do you turn down all the chatter in your head that's filling you with fear? How do you turn down all of the feelings in your body where your fear is living? And so therapy can teach you that. Some people just do talk therapy. Some people do a technique called cognitive and behavioral therapy. Big fancy words. Cognitive means thoughts. So it's looking at how you think, how you feel, and what you do when something happens. So baby cries. What's your first thought? Mm-hmm. Something's wrong.
Anxious.
Then you feel anxious. Then you pick the baby up and you're tense, and guess what? The baby gets anxious.
Mm-hmm.
So if you can be taught to pause, do a reality check. Oh, the baby's crying. It's been 2 hours since he's been fed. Baby's hungry. Now my thinking is calmer. I might still be a little anxious because I'm not breastfeeding and the formula's not ready. But I can pick the baby up and comfort him and say, it's okay, you're going to get fed in a minute. Very different outcome.
True.
Very different outcome. So cognitive behavioral therapy. You can also, you might also be exposed to mindfulness-based stress reduction. Meditation, imagery. When I was a midwife and a childbirth educator, I used a lot of guided imagery to create a false memory of a positive birth. Because a lot of my clients had had traumatic birth experiences, were now pregnant again, and every time they thought about having their baby, they went back to that scary thought. And there's been some success in reducing anxiety with the guided imagery.
This is never
with
known.
meditation. So any of you who have a meditative or a prayer practice, use it. Use it during your pregnancy, use it after the pregnancy. It can help bring your anxiety down. Women who have a strong spiritual connection, whether it's religious or not, tend to heal faster, even if they get the postpartum depression. Okay? So you can be taught that in therapy. If you don't know it, you can be taught it. And there are lots of different ways of reducing your anxiety, shifting your focus to a positive so that you don't feel as depressed. What else can we do in therapy? You can be exposed to expressive therapies. I use drama therapy in my practice, so I might role play. You know, as I'm kind of acting out things here, I get my clients to do that. I have dolls and puppets in my office. I work with adults. No, it's funny. They all walk in and go, dolls and puppets. But the dolls and puppets become props. Mm-hmm. You know, this is your baby. And it's over here and it's crying. And I make the sound effects. Show me what happens. And we practice how to do it differently by role playing. Some people use art therapy, and then it becomes when the baby's sleeping, I can do some artwork, or I can do some scrapbooking with the baby's pictures. So they find something creative that brings them a little bit of joy that can help calm the anxiety and lift the depression. Other things that can help. Little bit of exercise. If you haven't been exercising during your pregnancy, and I encourage you to do that because it makes the labor and delivery better, easier, more comfortable, start going for a walk. It's gorgeous out right now.
Yes, it is.
Finally.
Yes, thank God.
To be outside, to be walking, to be moving helps your brain because it releases the chemicals in your brain that help you feel good. It helps your body to get back into shape. And it helps you and your baby take a break. So you can be outside, enjoying the weather, out in nature, taking care of yourself physically, emotionally, and spiritually.
Excellent.
Now, the Asian community, the challenges there. I found a really interesting, some myths about mental health in the Asian community,
Excellent.
which I thought
We'd
was
love to
great.
share. Yeah.
Mental health isn't an Asian American issue. That's myth number one. Studies have shown that Asian American women across ages, as I said, have higher suicide rates than the national average. Elderly Asian women over 65 and men over 85 have the highest suicide rates compared to non-Asians.
Unbelievable.
Oh my God, yeah.
This was done by the World Health Organization in conjunction with Asian American researchers. So it's not outsiders looking in, it's inside
Insiders
information. Okay? Suicide is the 8th leading cause of death for Asian Americans compared to the 11th for the national population. So it suggests that there's something going on here
Definitely.
that isn't being acknowledged. Myth number 2, depression and mental illness is rare in the Asian American community. Few studies have specifically examined this, but what they have found is that when they compared Latino and Asian, depression-related symptoms were reported in approximately 10% of Asian Americans, and almost 16% of young women reported suicidal thoughts.
Unbelievable.
And that was statistically less than the Latino population.
Unbelievable.
Another myth, Asian Americans are more culturally prone to depression, which explains the high rate of suicide.
Absolutely.
Nothing has supported this. What is more significant is that they don't deal with it.
Correct.
It's there, but they don't talk about it. They don't do anything about it. Early signs of clinical depression are obvious. When we do assessments of our clients, one of the things we look at is it's a two-part assessment: the severity of the symptoms and how it impacts functioning. Somebody could have very, very severe symptoms and also be functioning really well. Somebody could have just a little bit of symptomology, either their thoughts or physically, and it has them in bed. There's no way to know. The response to depression is unique, it's individual, and it's exquisitely difficult to determine. I have some clients who are, and I know of clients when I was a midwife and now, women who were very high functioning, who didn't sleep because they were afraid the minute they closed their eyes something would happen to the baby. But man, did they get a lot done. Because they were never asleep. So the laundry was always done, the house was perfect, everything was perfect except that inside they were a jangled mess. And they were developing physical symptoms. So again, that bleak outlook, the unexplained aches and pains, the physical complaints, headaches, backaches, stomach aches, the loss of temper, anger, irritability, sleep changes, appetite changes, lack of joy. You've got a baby, maybe you can't be happy, but maybe the baby, it burps funny. You should laugh at that. If you can't find that joy, those are the things that say, there's a problem. Myth number 5, depression is a character weakness, and it means there's something wrong with me. No. Science seems to support chronic and clinical depression, while being triggered by the environment, is the result of biological and genetic factors, which means it's chemical. It doesn't mean you're shaming your family. It means something happened somewhere in your family tree that shifted the chemistry in that family member so that they could survive. And it's no longer serving that purpose. And now everyone's depressed. Depression is a mental illness. Depressed people are no weaker than people battling cancer. Cancer is a physical illness. Pregnancy is a physical condition. It takes a lot of strength to carry and birth a baby. There's nothing wrong with you. What is wrong is the chemistry. And it can be off because of hormones, it can be off because of genetics. It can be off also because of environment, if you've had a lot of other traumas in your life. Myth number 6, fixing racism or other social cultural stresses will cure mental health. Not true.
Not true.
Because it crosses all cultural, racial, ethnic, economic situations. People are depressed all over the globe. All over the globe. everywhere. Asian Americans are equally as likely as other ethnic groups to report mental illness and depression. We've just talked about that.
Yes.
They don't talk about it. It's not something that is comfortable being spoken about. They are less than half as likely as non-Asians to report anxiety, depression, schizophrenia. They will attribute these things to spiritual, karmic, chi imbalances, anything other than. And there's actually language for it. In the Chinese culture, there's a specific kind of language that talks about the chi being off so that your mood is off.
True.
Only 2% of Asian Americans will mention symptoms of depression to their doctors, compared with a national average of 13%. Myth number 8. Mental illness is embarrassing, and I can treat my depression on my own. I can't tell you how many times we hear, I know what I need to do, I just need to tough it out. Yeah, and how long have you been doing that? How long have you been toughing it out? What do you think, Soph? And how's it working? You know? If it were that simple, we would do it, right? So, you know, even exercise can only lift depression so much.
Yeah.
It helps. But clinical depression that goes undiagnosed or treated can last a lifetime.
Sure.
And then you really will be feeling hopeless and helpless forever.
So what would you suggest
Ask for help.
right off the bat? Ask for help.
Something's not right. I'm either feeling it in my body, I'm feeling it in my heart, and my thinking is confusing me. It doesn't have to be that I'm having bad thoughts. It's just I don't understand why I'm thinking what I'm thinking. Mm-hmm. If you can say to somebody, this is what's going on and I'm confused, just start with confused. It may not be clinically postpartum depression. It may just be your hormones finding their balance again. But if you ask for help and find out, you're more likely to shorten any of the symptoms. The duration, the frequency, and the intensity can come down if you speak up and ask for help.
Maybe they're scared because people are scared because of medication.
Absolutely. And not every depressive condition needs medication for treatment.
Okay.
As I said, I don't prescribe.
Right.
We have clinicians in our office who are prescribers. That's their job. I joke, my prescription is drink water and walk and eat right. You know, eat healthy. Self-care.
Yes.
Okay? You don't need to take medication necessarily.
Okay.
Sometimes you need to take it for a little bit of time, just to help things reset. It's not like a heart condition where, and in the Asian community and in the Caucasian community, it's much more acceptable. If I have diabetes, of course I'm going to take my insulin. If I have a heart condition, of course I'm going to take my medication. That makes sense. It's my body.
Right.
You know, I have pain, I'm going to take my pain meds. Okay. You know, you've got a different kind of pain. It's not in your body, it's in your mind. Why not take care of that? Some people, again, that risk factor of the family history, they might need to be on medication long term. And then if it's a woman of childbearing years and you want to have more children, you work very closely with your doctors to find a medication that can keep you on an even keel, balanced, centered, grounded, feeling whole and together, and engaged, that doesn't hurt your chances of having another child. And they're out there. The truth is, for most people, that's not the case. You might need medication to get through that first 3 months or 6 months. If you're breastfeeding, It's a little bit more challenging to find the right medication that isn't going to hurt the baby, but they're out there. And there are lots of other therapies. When a client comes to me referred by an OB for the first time for postpartum care, they want to know about medication, and I say, well, let's try therapy first. If the skills that you're learning with your therapist don't help, then we'll talk about it. It's a conversation. It's a dialogue.
Right.
And the doctors in this community understand that. So they may come to me for an intake and go see another therapist down the road. They, not everyone, I can't see everybody that comes to the agency. We have 700 therapists. There are a lot of us who can help.
For different issues.
Right. And, there are quite a few who are quite skilled in this area.
Right.
And we all, like I said, there's a lot of different approaches. But let's start with the therapy. Let's start with seeing if we can shift your thinking, if we can help you learn the skills that you need to calm yourself, to refocus, to do a reality check. This is what I'm worried about, this is what I'm sad about, but what's happening right now isn't either of those things. Those kinds of therapies are really helpful. Most of the clients I've seen since 2006 that have come in for postpartum issues, it's a 3 to 6 month course of treatment, and most of them are not on medication.
Excellent.
So we're talking 3 months, 6 months, less than a year. Statistics have shown that about half of all women who have postpartum depression, eventually the depression resolves in about a year with no treatment.
Oh, okay. Yes.
Okay? With treatment, it's 7 out of 10 instead of 5 out of 10. So it increases your odds by a little bit. It still increases your odds. And really what you want to do is be the best mom you can be. And this is a way to optimize that, to help get all of this other stuff out of the way so that you can do that.
It's so true. It's my personal experience that I had with postpartum depression, and I'm quite aware of all the symptoms. But what I thank you is the way you brought it to me as well as to my viewers in a common layman language. And what you said was so true. And South Shore Mental Health has been in the area for such a long time with so many resources to offer. And really unbelievable that the last resort should be medicine unless you're psychotic. But before that, the therapist really helps you.
Right.
Especially if you're alone in this country.
Right.
And you have no one, you have no support system. You just have to look for, as you mentioned, South Shore Mental Health. You have our phone numbers you will see on the screen. Do contact them at all times.
Yeah.
I'd like to ask you one more thing. Is for insurances, like people are scared, like how are they going to pay for? Because it's a big question. I know our viewers would want to know this.
Right.
Yes.
Anyone who has insurance of any kind can come to South Shore Mental Health.
Okay.
If you've had insurance that helped cover your your pregnancy, labor, and delivery, we accept Mass Health.
Okay.
We accept commercial insurance. When you call intake at our main number and you ask for intake,
Peter, would you please put up the main number for South Shore Mental Health? Thank you.
When you call the main number to South Shore Mental Health and you say, I'm calling because I had a baby and I need some support, and that's really all you have to say, they will ask you what kind of insurance you have. They will get that information. They then forward, depending on where you live in the South Shore, they forward your information to one of our offices. The program directors at that office then assign you to one of the therapists who is skilled in this field, in this particular area. Somebody who is sensitive to the needs. We try to match people up culturally. It isn't always possible, but we're doing the best we can.
But sometimes my personal experience is better to speak to culturally,
same culture.
it's not the same culture,
Yeah.
because you have a more liberal, more open. The way
Minded.
you spoke to me, if I was in that situation, trust me, I wouldn't speak to no one else other than you. And that kind of, how you develop a relationship is immense. And the way you calm things down, the way you explained, I was dumbfounded because I just agreed to every word you said. And thank all those calls that we receive for postpartum depression.
Right.
My heart goes out to all of you. But do contact and do take care of yourselves.
Yeah.
Maybe we will have Jamie come over more often to speak about
Thank you.
Any kind of depression,
Any
actually.
kind of depression, absolutely.
Which is very important, especially
Yeah.
to us Asian women. It's quite important because I don't think a lot of people realize like how important it is just to talk, to have
Just
somebody
to
listen
talk.
to you.
You know, regardless of your race, regardless of your ethnic background, regardless of your culture, if your own thoughts are confusing you or frightening you, ask for help. It doesn't matter what race, what religion, what culture. If your own thoughts are frightening you or confusing you, that's a sign to ask for help.
Thank you
Right.
so much. It was a wonderful evening. Thank you, Jamie.
Thank you.
Thank you, South Shore Mental Hospital. No, is it
Mental
South
Health.
No, I apologize. It's South Shore Mental, and this is Jamie Osborne.
Yes.
We'll see you again next time.
Well, and I'm so we'll see you next time.
Bye.
Bye-bye.